And a very warm welcome to you all to another segment in the BAPS Wellness webinar titled Winter Jabs, Do We Still Need Them? My name is Rakesh and I'm a GP and a volunteer within the BAPS healthcare team. This series is a part of the BAPS Wellness Initiative, which is all about promoting both physical and mental well-being through nutrition, exercise, sleep management and stress management. The series is inspired by our gurus Brahmukh Swami Maharaj and Mahant Swami Maharaj, whose teachings emphasize the need to look after both body and soul. A key part of remaining healthy is illness and disease prevention, and using vaccines which are available to us are fundamental to this goal. I would encourage everyone to ask any questions in the chat function of Teams, and we will endeavour to answer those questions. We are greatly fortunate to have two members of our BAPS healthcare team join us this evening. Firstly, I would like to introduce Dr Pujan Patel, a consultant respiratory physician at the Royal Brompton Hospital in London, and Dr Nirav Amin, a senior GP and clinical director at Station Road Surgery. So without further delay, I will hand over to both Dr Pujan Bey and Dr Nirav Bey.
Wonderful. Thank you very much indeed for the introduction, Rakesh Bhai, and just on run and good evening to everyone who's joining us on this evening's webinar. So what we were thinking was over the next 20-25 minutes or so, myself and Nirav will take you through a bit of an insight into what we've got available in terms of winter jabs for this upcoming season, and in particular, try to spend a little bit of time on kind of identifying who is actually eligible for this season's flu jabs, but also share a bit more detail into a lot of the common things that we hear in our practices, both in specialist centres and also in primary care, where Nirav works. So I will move on to the next slide. And here, what I actually wanted to do initially was ask everyone to take a little bit of a different view on vaccines themselves and the idea of vaccination. And the reason I say this is because often people think about how vaccines will impact them and what the vaccine is doing to their own body. But what is often missed and overlooked is the impact that vaccines are having on those around us. So if we look at the first point, the first issue is actually that we're not vaccinating ourselves purely and solely to look after our health, but actually to look after those that are vulnerable around us. So despite you feeling or being healthy, there is still those around us who don't have the same immunity, the same protection, the same maturity in their immune system, and thereby requires a little bit more support from the community, which is something that we're all very familiar with when we think of things that we've been taught and things that we hold dear to ourselves, such as principles of sum. The next point to identify is that by vaccinating not just yourself and those around us who are vulnerable, we also can actually ease the pressure on the healthcare system. So for example, if we look at last year, just in England alone, the flu vaccination itself was able to reduce 100,000 hospitalisations. So just imagine the capacity in the hospitals, which, as we all know, are already very stretched during the winter season, can be really eased and allowed for other people who are even more sick or need more attention to be looked after, while you, having had your vaccination, can recover at home with conservative measures. The other thing that's a little bit more individualized to our community in particular would be the fact that we have so many festivals. And so in that context, we know that there are going to be masses of gatherings, large gatherings that we all would love to attend. And again, in order to preserve the safety of those around us and to ensure that we're not passing on conditions, because that's predominantly how a lot of these viruses are spread. And it's often the younger children passing to the older generation, and you'll see how that's reflected in the criteria for the access and use for these vaccinations. And the last thing we'd want is to spend a year planning a wedding and then unfortunately not being able to attend because we just weren't in the right state of health after not having, looked after not just your own vaccinations, but those of those around you as well. And then again, even more particular to our community is the multi-generation households that we often live in. And therefore, sometimes you end up having to vaccinate yourself in order to protect those that are more vulnerable around you. And we'll see that over the next few slides. So next, there's just a brief summary of the vaccinations that we'll be going into. And over this particular winter season, we'll be speaking about the influenza vaccine, the COVID-19 booster and the criteria and the recommendations for those, the pneumonia, the pneumococcal vaccine, the shingles vaccine, and a slightly newer vaccine that's been available only just for a couple of years, which is the RSV vaccine. And I'll speak a little bit more about that as we get to it. So those are the 5 vaccines that we'll get into, and then perhaps I'll ask Nirav to take us through to the first of the vaccines.
Yeah, thank you, Pujan Bhai. I think this one is probably the one that we've all heard the most about, arguably the flu vaccine. You probably all get messages about either a loved one or your children, or even yourself if you qualify to have a flu vaccine this winter. The question is really who should have it, and there is a split category. So from the 1st of September, all pregnant women are eligible to have it, and any children aged 2 or 3. Now, there are people and children with certain long-term health conditions, which we'll go through shortly, will make them eligible all the way through their lives. But the lion's share of the people who will need flu vaccines are going to be children and also the over 65s. Now, there are certain ways that these vaccines are delivered. For example, flu vaccines are given to children through their schools, especially if they are attending school and they're not in nursery. They will be offered their flu vaccine through the school. And I think it's really important to understand how that process works. So if you do have a school-age child, be expecting to have received in the season a note from your teachers to say that your child is eligible. You will need to agree to consent, and at that point it's really important to discuss or ask for a vegetarian version should you wish, because the default version is a nasal flu vaccine, and unfortunately the nasal flu does contain pork gelatin. So especially in our community with the focus on vegetarianism, it's important to be aware of this. There is a vegetarian version, and it is an injection, but it's one to be aware of, and it often has to be requested, and then they're able to give it. Equally, your GP would also be able to offer that if requested. In terms of the flu, for adults, 18 to 65-year-olds are also eligible if they've got certain conditions, certain long-term health conditions, as well as patients who live in care homes or carers of those who are immunosuppressed or have concerns at home about their health. So a lot of people live, like Pujan Bhai said, with their grandparents, their parents, or patients who are immunosuppressed or vulnerable due to their age. And as a result of that, we do encourage a lot of our community to be vaccinated, to protect those who are at risk around you. Of course, healthcare workers and social care workers also qualify. So if you are a carer, you also qualify. We've got a list here. Apologies, it's quite lengthy, but it does explain why the flu is so important, because there's so many conditions that are putting patients at risk, and you might not think that it's putting you at risk, but it's really important to be aware that if you have chronic kidney disease, if you have liver disease, if you have heart disease, you are much more likely to deteriorate if you were to catch the flu. And that applies to things like neurological conditions, Parkinson's, diabetes, or even concerns with your spleen. So if you do get contacted by your GP, it often means you are already eligible. So please do take that up and get yourself vaccinated. It's one of the best things that you can do for your health. Over to you, Pujan.
Great. So the next vaccine that's available for this winter season is something that we're all very, very familiar and probably fed up with as well. So we have the COVID virus, which is still circulating, and I'm sure that we've seen in a number of articles are in the news. There are different strains that are still very much infecting people and giving them the usual symptoms that we get from colds and flus. But fortunately, we're definitely not in the pandemic state anymore, which has allowed the winter booster vaccine criteria to be eased. And actually, as you can see here, there are only 3 scenarios really that people now need a COVID booster vaccine. So number one being anyone in a nursing home, so nursing home residents, and primarily because, as we all remember, these were people who are higher risk. There were environments where spread would be very easy to occur, and also those who are most frail in the community. The other group are people who are essentially age 75 or older. And that also includes anyone who's going to be 75 before the end of January. So if you're going to be 75, you'd still be included in that category. And then the final group is essentially anyone from the age of 6 months upwards, but with a weakened immune system. And here on the right, you can see a brief list of what that means. And I think it's difficult for everyone because this list has been changing and evolving over the years. Even for ourselves as doctors, we find that we often have to keep reminding ourselves, keep looking at the criteria because the various committees, such as the JCVI and around the UK, who make these decisions based on looking through these are panels of experts who really essentially spend their entire careers around vaccines and understanding the details behind each and every one of these viruses. So these people that come up with the recommendations are purely basing this very much on people who are now high risk in the context of COVID-19 now being something more that's endemic as opposed to in that kind of pandemic state. So conditions such as anyone who's on chemotherapy, anyone who's has anything that's going to suppress their immune system. So that could be even treatment for things like rheumatoid arthritis or inflammatory bowel disease. And if you're not sure, the best person to ask would be essentially the people who are treating you. If you think you're on an immunosuppressive medicine, whoever's prescribing that would be the right person to speak to. And then beyond that, the GPs would also be able to guide you as to whether or not you'd be on that list. It's generally automated, but but I am aware that there was some news articles about people getting the old criteria. So last year it was 65 for the COVID booster, and this year you can see it's 75. So there have been some cases, unfortunately, of people getting text messages when they did not qualify. So just to be clear with everyone, the age cutoff is 75, or you're in a care home, or you have one of these weakening immune system conditions, and you're above the age of 6 months.
And Pujan Bhai, could you talk a bit about the steroid element? Because there might be people who don't think they're classically immunosuppressed, but actually may be taking a steroid for a different reason.
Yeah, that's a very good point, actually. So anyone who's on prednisolone, which usually is these tiny little white tablets, is considered as a steroid and actually considered as an immunosuppressant. So anyone, generally, the guidance is 20 milligrams. So if you're taking 20 milligrams worth of prednisolone, you've taken it for more than a month, that immediately classifies you as eligible and in this kind of weakened immune state, and therefore you would be someone who should definitely have a COVID booster for this season.
Thank you. Let's roll on to the next one, pneumonia.
Yeah, so the other one that again affects the lungs, as all of these previous viruses that we've just spoken about, is the pneumonia. And this is slightly different because the previous ones we've all shared with you are viruses. And with this particular jab, it's blocking a bacteria. So pneumococcal is the name of the bacteria, but specifically there are lots of different types, so subtypes within Streptococcus pneumoniae is the name of the bug, but there's different subtypes which have all these various different letters. And what we're trying to do is trying to pick out the most common or the most frequently encountered strains to then give your immune system a bit of a boost and memory to then be able to face those bacteria strains when they do come across. The thing to remember is that it does not protect you from any pneumonia. So as much as we've written pneumonia here, we're specifically talking about a common bug, a common bacteria that causes pneumonia, but can also cause more severe conditions like systemic infection, which means infections in your blood, infections in your brain. So with pneumonia, with Streptococcus pneumonia, you can also get widespread, massive kind of inflammation within the body, and that's also known as sepsis. And so to protect those that are higher risk after the age of 65, it's recommended that you have a dose, and you don't have to have repeated doses. So it's a one-time dose, and that covers you for the remainder of the time. The other thing that naturally happens to most babies, and I'm sure anyone who's had children and on the webinar today would be aware that at 16 weeks, the pneumococcal vaccine is given to babies, and then a booster dose a year later. And then anyone essentially that's considered as high risk would be getting at least a dose. And again, you can see, we'll put up on the right-hand side, this kind of long list of weakened immune. And you'll see familiarity because a lot of these conditions do overlap. The one thing I will say is the COVID list in terms of who would be considered as high risk seems to be a bit narrower and a bit tighter. But for the other vaccinations, it's very similar. So again, people that have more chronic conditions such as heart disease, kidney disease, and even those that have obviously been any immunosuppression, so chemotherapy, treatment for cancer. So all those are considered in this kind of higher risk group. And the difference being here that it's a one-time dose, and it's often something that's targeting immunity from bacteria, but it does not mean you will never get a pneumonia. So you're still at risk for pneumonia. It's still important to do our very, very basic essentials, and the basic essentials are no different to what we were taught during the pandemic. We were taught about washing our hands. We were taught about using alcohol gels, and we were taught about doing just polite general hygiene of coughing into tissues, coughing into your elbow, and not exposing others. And these are all things that are universal for all the vaccines that we've just talked about, because ultimately they are spread exactly in that manner.
I mean, I think it's really important with the pneumonia vaccine, and just for our Gujarati audience as well, it's important to maybe if I explain. Pneumonia vaccine માંથી 23 જાતના બેક્ટેરિયલ નિમોનિયાનું રક્ષણ થાય છે. મતલબ કે 23 જાતના જુદા જાતના નિમોનિયાની સુરક્ષા થશે. તો એક ઇન્જેક્શનથી જિંદગીપૂર્વક તમને એ રક્ષા થશે તો કેટલો બધો ફાયદો થઈ શકે. હવે જેમ પૂજનભાઈએ કીધું કે બધા જાતના 24મું જાત અને 25મું જાતનાથી રક્ષણ નહીં થાય, પણ એટલીસ્ટ 23 જાતના તો રક્ષણ થઈ જશે, અને એક સોયથી તમને કેટલો બધો ફાયદો થઈ શકે. તો ઇટ really really important, અને ઘણા બધા ઓલરેડી ક્વોલિફાય થાય છે. આમાં રિકોલ પ્રોગ્રામ છે નહીં, એટલે તમને કદાચ ઈમેલ કે વોટ્સએપ કે ટેક્સ્ટ મેસેજ નહીં મળે તમારા જીપી પાસથી, એટલે તમારે પૂછવું પડે. અને તમને એવું લાગે કે હું ક્વોલિફાય થઈ શકું તો તમે પ્લીઝ જીપી પાસે જાઓ અને પૂછો, કારણ કે ઘણા બધાને ક્રોનિક કિડની ડિઝીઝ હોય, માઇલ્ડ હોય પણ તોય ક્વોલિફાય થઈ શકો, ડાયાબિટીસ હોય, એસ્મા હોય, તો ઘણા બધા કારણથી તમને ક્વોલિફિકેશન થઈ શકે. તો પ્લીઝ તમે પૂછો તો તમને ફાયદો થશે. એવી જ રીતે આપણા છોકરાઓને ઘણા બધા છોકરાને નિમોનિયા થાય છે, અને જેમ પૂજનભાઈએ કીધું કે ઇટ્સ રિયલી ઇમ્પોર્ટન્ટ કે એ લોકોને બી પ્રોટેક્શન થાય. હવે આવી રીતે 16 વીક્સે 16 વીકે બેબીઓને ઇન્જેક્શન આપવામાં આવે છે. હવે એક જુદો જાતનો નિમોનિયાનું વેક્સિન છે, પણ તોય 13 જાતના નિમોનિયાનું રક્ષણ થાય છે. That protects them all the way through childhood. એટલે બાળપણામાં એમને રક્ષા થશે, and it protects them not just against pneumonia but also meningitis. એટલે અમને ખબર છે કે meningitis is a big killer in hospitals in children who get unwell, and આનાથી રક્ષણ થાય તો why should we not do it? It's part of the regular immunizations. એટલે એવું કઈ માગવું ના પડે, પણ પ્લીઝ જ્યારે તમારો સમય થાય for 8 weeks, 12 weeks, 16 weeks, 12-month injections for the newborn babies, બહુ જ important છે. Now, shingles is another vaccine that we often have heard about. Even me as a GP, I get so confused about who is allowed to have it and who's not allowed to have it, because every year for the last 5 years it's changed. Generally speaking, 70 to 79-year-olds are eligible. Okay, it is a 2-dose vaccine, one now and one in 6 months. So for the lion's share of people watching, between 70 and 80 ની વચ્ચે તમને eligibility છે. But you cannot, if once you hit 80 years old, you will no longer be eligible. એટલે તમે મોડા પડો તો then નહીં આપે તમને, એટલે પછી privately લેવું પડશે. There is a move in the NHS to bring this down lower and lower and lower, and they are trying to vaccinate people from 65. Okay, this is where it gets a little bit complicated. You might think that I am 67 and I'll be allowed to get vaccinated, and it doesn't quite work like that. So if on the 1st of September 23, you are eligible when you turn 65. You'll be offered 2 doses, like I said, one now and one in another 6 months. However, when you, if you turn 65 before the 1st of September 23, you'll then be not recalled early, you'll be recalled when you're 70. So there's a staggered sort of catch-up campaign to bring everyone who's between 65 and 70 up to date. The easiest way, honestly, is to call your GP and ask them if there's an alert saying that you're eligible for shingles or not, and they'll be able to tell you. So what is shingles? Now, many of you will know what chickenpox is. You may have heard of that, childhood disease. છોકરાઓને નાના નાના ફુલ્લી થાય, બહુ જ કરડે, usually અઠવાડિયા જેટલું duration હોય, અને it's a mild illness. છોકરાને તાવ થાય, કરડવાનું થાય, અને એ નાના નાના ફુલ્લી જેમ તૂટે એટલે બધું પાણી નીકળે તો બીજે જાય અને બીજે ઇન્ફેક્ટ થાય, અને there is an infectious condition. So what does that have to do with shingles? અઠવાડિયું જ્યારે બીમારી પ્રકરણ થાય છોકરાઓને ત્યારે એનું શરીરમાં એટલા બધા એન્ટીબોડી બનતા હોય અને આ વાયરસને અટેક કરતા હોય, એટલે એ વાયરસ પછી જતું રહે. પણ એ વાયરસ હમુરકું જતું નથી રહેતું, એ તમારા શરીરમાં રહે છે અને એકચ્યુઅલી તમારા સ્પાઇનમાં રહે છે, સ્પાઇનલ કોડમાં એ બેસી જાય અને ત્યાં સૂઈ જાય, અને ઘણા વર્ષો સુધી, ઘણા ડેકોડો સુધી એ સૂઈ રહેશે. પણ જ્યારે ઉંમર થાય, ઇમ્યુનોસપ્રેશન થાય, ધારો કે સ્ટેરોઇડ લેવી પડે કે બીજા કઈ કારણથી તમને ઇન્ફેક્શન થયું હોય અને બીમાર હોય અને ખાટલે વશ હોય કે just very very stress, even just a high level of stress is enough to bring your immunity down. તો એનાથી એ જે પ્રોટેક્શન થતું હોય એન્ટીબોડીથી એ નીકળી જાય અને all of a sudden rash નીકળે, અને એ rash સખત પેઇનફુલ હોય, એ બહુ દુખાવ હોય, યુઝ્યુઅલી વન સાઇડેડ હોય, એટલે વચલેથી આગળ ના જાય. If it's on your left side, it will only go towards the midline and આગળ નહીં જાય. So it will only cover half of your body. Usually this happens on the chest, એટલે શરીર ઉપર, છાતી ઉપર કે કેડ ઉપર, અને it will cover half your body. નાના નાના ફોલ્લી, જેમ ચિકન પોક્સની જેમ ફોલ્લી થાય એવી રીતે નાના નાના ફોલ્લી થઈ શકે અને લાઈ બળે, અને એ લાઈ છે ને વર્ષો સુધી રહી શકે અને ઘણા બધા દવાઓ લેવી પડે. તો એ ના થાય તે માટે આ વેક્સિન બારે પડેલી છે, તો એનાથી તમને ફાયદો થાય તો it's better. There is a number of conditions that make you eligible if you are younger, so 50 plus, actually 18 plus now, sorry, with a weakened immune system. Like Pujan Bhai said, this is if you have a severely compromised immune system, such as blood cancer, HIV, chemotherapy, or some immune modulating agents. So please always ask if you are on these extra lists. Often your hematologists or specialists will tell you and the GP that you are eligible. But if you are between 65 and 79, just check with your GP and see if you're eligible this year, and start that process rolling.
Thanks, Nirav. That was great. And so the next virus, which we wanted to talk about, the next vaccine that's been available, is probably something that many of us haven't heard of, because it's only been available for the last few years. It was only approved about 2 years ago, and this is RSV. So RSV is a virus. The letters stand for respiratory, so lung syncytial virus. And what this virus has been doing for we've known about this virus for many, many years. So it's not a new virus. So that's the first thing to say. The second thing is we've been struggling to find a vaccine for this virus, because when we look at what's been happening over years, we can see that actually, when you look at the elderly population and the very, very young, so newborn population, In those two groups, we are seeing an incredibly high number of deaths from RSV infection. And you can understand that in a newborn that's just less than 6 months old, the immune system hasn't even matured, so they're high risk. And obviously, as we get older, there's also changes in the immune system. So 75-year-olds and above will also be at higher risk for having a worse outcome when you get infected with RSV. So what RSV does is once it gets into your lungs, it tends to settle lower down in your lungs. It tends to give you lots of shortness of breath. You can get a pneumonia from RSV. And ultimately, in the last year, there's been over 8,000 deaths in people that are over the age of 75 from RSV itself. So just to give you an idea of the impact of RSV, but all we've been doing is we didn't have a treatment, or there was no preventative mechanism besides washing your hands and taking precautions that we all know about to combat it up until recently. And what they found is a vaccine. There's two companies that make this vaccine, but the vaccine is essentially still using the traditional mechanisms for vaccine development that we've been using for flu vaccines and other vaccines in the past, but also demonstrating somewhere between 83 and 89% in one of the studies of efficacy. So the effectiveness is very high, and it's much better than an effectiveness of essentially zero, because that's where we were prior to this vaccine being available. So it's great that we have access to the vaccine. The reason, as I said to you before, that we have these specific age groups, so 75 to 79, or for mothers who are in their third trimester, so the final trimester, because that will allow you to develop the antibodies in good time to then pass on to a newborn. And that will give them enough protection while their own immune system matures and develops. And in that period where they're at the highest risk, you're going to reduce the chances of having to bring them into hospital, reduce the chances of having to admit them in hospital, and obviously reduce the chances of something even worse happening. So the fortunate thing is we're now in the era where we have access to these biologics. They're not these vaccines. They're not using the same technology that was being used within the COVID vaccine itself. So it's still our traditional way of developing a vaccine that's allowed us to use the RSV vaccine, and is something that's available now for those two categories of patients. And I think that probably covers all the winter vaccines that are available for the season. So just to recap again for everyone, we went over the flu vaccination and the criteria that's available now for access to the flu vaccine. And the emphasis really is on how we can protect those around us in the community, because the impact is not just ourselves, but to those who are in our extended families or at higher risk. COVID-19 booster, because there's no obviously new COVID vaccination, the pneumonia jabs, shingles jab, and then finally the RSV jab.
So we've talked a lot about the way that we as a community live in multi-generational households. We often have young mothers either pregnant or have young families. So we have to be mindful of the fact that we are often surrounded by patients who we are thinking of as just our family members. But as healthcare professionals, we are seeing them, unfortunately, as categories of vulnerable patients that will suffer disproportionately than other patients. And we have to be mindful of those who are at further risks. We have to protect them. We have to protect them even more than we would the middle cohort. As Pujan Bhai said, you know, the RSV vaccine, just to give an example, 14,000 hospitalizations last year from RSV, and 8,000 মানুষও মরে গিয়া from RSV alone. Whereas एक vaccine थी 80% reduction in admission. Okay, 80% 14,000 માંથી દાખલ ના થયા. હવે દાખલ ના થયા એટલે that could be a mother, or it could be an infant, a baby, or it could be an elderly relative. And we can think how powerful a simple vaccine could be. Pneumococcal infections, like Pujan Bhai said, can cause such a huge burden of illness, including obviously pneumonia, but also meningitis, sepsis. And we might not think, oh, my lungs are fine, but it might not be because of your lungs being abnormal, but it could be because of your diabetes, or it could be because of your heart disease that you suffer. And unfortunately, 40 to 60% of those patients who get admitted, and they have severe cases, and that's because of their underlying health issues. Now, you're probably thinking, okay, we get it, vaccines are important, but sometimes I'm willing to take my chances, and I'll just get my natural kind of immunity. I can shrug these things off with a bit of ardar and doodh and some honey and some rest, and I'll be okay. And you're not wrong. You probably will be okay. But the question here is, will everyone around you? You probably will be okay. But what we are seeing through years and years of evidence-based data is hybrid immunity. So hybrid immunity means both exposure to these infections in the community, but also combined with vaccine, because vaccines help produce long-lasting immunity. So that plus your exposure to just living in the day-to-day world will help produce broader and longer-lasting immunity. And this has been found hugely in lots of vaccines that we've talked about today, not just RSV, but pneumonia, but also even COVID. The Health Security Agency in the UK have found that COVID reinfection risk was about 3 times lower in someone who's been vaccinated, even if previously had been infected. So the vaccines help longer lasting immunity than simply infection alone. Okay.
And then the other point to add, if I could add on, actually, is that it's actually very specific to the South Asian community. I'm sure everyone's very familiar with how the risk for heart disease and diabetes is almost 2 to 3 times greater in the South Asian community. So we are at risk for having weakened immune systems from the presence of diabetes alone. The heart disease as well, when it's uncontrolled, especially, offers yet another risk factor. So we are not only prone because of our lifestyle and how we like to celebrate festivals or be around each other, but also genetically prone to being at more higher risk, which is why more attention is definitely required on vaccinating and really taking a deeper decision as to the merits of vaccinating. And I'm mindful that we've got a lovely number of questions coming through on the chat. So we'll take you through some of our next few slides rather swiftly, so we can open up the floor for questions.
So just on vegetarianism, I know that this is going to be key to a lot of people on this call, and worried whether vaccines are vegetarian, and absolutely you can get a vegetarian vaccine. Don't worry. It's sometimes not necessarily what's going to be offered to you though. So you can ask for it, you can request it, but look at how many are automatically vegetarian. That's the flu, 18 to 64. Shingles, pneumonia, RSV, and COVID are all vegetarian without having to worry. The nasal flu is not, which contains gelatin. You can ask for the 18 to 64. That is safe to be used from 2 years old. The flu over 65 that's standardly given isn't vegetarian. It contains egg. But again, the over 65 can also ask for the different flu vaccine, the cell-based vaccine, and that's vegetarian as well. So there are alternatives. You just have to ask. So let's go on to some questions.
Yeah. So why don't we do that? And I think we might be able to actually address a lot of the questions that are coming in for us with this almost quick-fire style question. So I had a question for you, Nirav. So what I hear quite a bit is from patients is that, look, I had the vaccine last year, so I'm fine. I already had a dose, so I don't need another one. What's kind of your thoughts? Well, what do you say to your patients about this?
I mean, look, vaccines are important. Some deliver long-lasting immunity, but often they have to be having booster shots like the flu and like the COVID, because vaccines reduce severity, hospitalization, and death. And flu jabs reduce that severe illness by about 70% and COVID by about 60%. So it's not just binary, it's layered protection. We have to accept that viruses will mutate constantly, they'll change. So you need new yearly updates to that vaccine. So that's why vaccines, having them 1 year doesn't mean you'll have lifelong protection, especially for viral ones. So I've got one for you. How about this one? Vaccines can give you the flu. What do you think about that?
So yeah. So I mean, look, I think we have to take it back to what is exactly how these vaccines are made. So what's inside a vaccine? That's the main question. And what they do when they make vaccines are they do take, copies of the virus, but they deactivate it. So they inactivate the virus. They take out all the toxic parts of the virus, but they still leave some protein, some components of the virus that will, once it's injected into you, will cause your body to react as if it's having an infection. And by doing that reaction within the body, you build up the antibody, so you build up the protection so that when you get the real infection, you are able to tackle it and fight it in a much better way. So it's very much a training process as opposed to a genuine infection. And I'm sure, I'm sure some people will feel like they've been hit by a train. Some people's immune system is just in that way, where they'll have a vaccine. And so for those people who know that they tend to react to vaccines in such a way, I often suggest that maybe try a Friday so that you can spend the weekend to try and recover. Because it does happen. There are people, and there's definitely patients who have come back and said, I feel awful, terrible, I've been sick. The other thing to remember is, in order to catch influenza, you've got to remember that it takes a couple of days. So once the virus enters your body, you don't get symptoms until a few days later. So you can't have a vaccine one day and within 24 hours, you can't have the flu unless you picked it up 2 days before. So in reality, the vaccine itself does not have the virus inside it. It has components of the virus. And the idea is very much to train the immune system to fight it, so that when a real thing comes in, you're in better shape. And just imagine if you felt this awful when you got the vaccine, which is not the real thing, imagine how bad you would have felt if you got the real thing first off.
Absolutely. Yeah, absolutely.
Why not? And next one, I've got someone who, well, I often hear people that say, probably not so much in the hospital, but outside, who ask me, I'm fit, I'm healthy, I don't have medical problems, so I don't need a vaccine. I'm fine. It's just my body's good. So what do I need to bother about getting a vaccine? What do you suggest to them?
It's a great question, because a lot of people will be thinking, look, I am fit, I'm healthy, I'm young, I don't have to have a vaccine to protect myself. I just need a good diet, a lot of exercise, and lots of ginger shots, and I'll be all good. And that's not necessarily inaccurate to a degree, but like we've said, we are living in a community. You're not living in a bubble. We are living in a community with elderly patients, with young people, with pregnant ladies, and healthy people can spread illness to vulnerable family members. And many of you have got elderly relatives. You may be thinking, I don't want to cause severe illness to them. It might not to you, but it might to them. And think about the opposite way of this. By you having a vaccine, what's the risk to you? What's the harm to you? Most side effects from a vaccine are mild. They're short-lived. Maybe a bit of arm pain, a bit of tiredness. These are very, very, very mild things. If I were to talk about even COVID, I know that there's patients that are worried about taking a COVID vaccine because of risks of things like myocarditis. This is an extremely, extremely rare side effect, about 1 in 100,000. Whereas having a COVID infection is a risk of myocarditis of 1 in 5,000. So you are so much more likely to develop these end complications by having the illness than you are from the vaccine. 20 times higher from the disease than from the vaccine. And that's from the European Heart Journal. So I think we really ought to think about not just ourselves, but the fact that we don't live in a bubble. Now I've got one for you, Pujan Bhai. If I have had the flu, I don't need the vaccine this year. What are your thoughts on that?
Yeah, look, the reality is that you do develop natural immunity, but the problem is that fades. So that's not long lasting. And so the benefit of the vaccine is actually to supplement or to support the immunity that you already do have. So I often find having to explain to people that that's fine, you can have the flu. The other thing I want to separate, and I think there's a good opportunity to do so, is we often use this term, the flu, very commonly, very easily. But what we're specifically talking about in these vaccines is influenza. So whenever somebody says, I have the flu, usually it's the common cold. And the common cold is going to be some of the average viruses that are around all year round. Rhinovirus is an example, adenovirus. So these viruses are around all year long. However, we're not talking about those. We're talking about a specific virus that is incredibly toxic, which is influenza A, influenza B. And these two kind of subtypes of the influenza virus are the things that you need protection from, and the things that unfortunately I have seen, personally in hospitals, in ICUs, patients not surviving infections with those. And so when you see this in front of you, it's hard for us to stay quiet and see people pass away from such severe infections. And so the validity of these vaccinations is very strong because they're updated every single year. So there's new strains that are updated based on what we see in the southern hemisphere, and that's influencing our protection and our kind of plans for how we use the next strain of the influenza vaccine. So definitely still, if you fall into the categories that we've already just mentioned to you, if you fall into those age groups and those risk groups, then please do still have the flu vaccine.
And
so,
it's true that you can die. You can die from the flu, but you can't from the cold, right?
Exactly right. So the only thing that really tells people that they've got influenza is probably how awful they feel. So generally, everyone's going to feel awful after cold, but we all know what a cold feels like. But there's sometimes you experience something that feels even more than that. You can't move. You're stuck in bed. You absolutely got no energy whatsoever at all. And it's those circumstances you kind of have to think that maybe it's the influenza that you've got as opposed to just the flu. And so it can be extremely deadly, and sadly things that we've definitely seen before. So what about another topical point? And I think this has become more common since COVID, because before COVID, I don't remember anyone asking me this really at all. And so the question for you is what about fertility problems? So vaccine, I don't want to take the vaccine because it causes fertility problems.
I mean, it's a great question. A lot of studies have been done since the COVID vaccines came out, CDC, BMJ, and they've actually found no link between COVID and flu vaccines and infertility, both in men and in women. So I know it was seen at the beginning. Sometimes periods were a little bit delayed, but there's been no effect on sperm count reductions, pregnancy rates, fertility rates, absolutely none whatsoever. What about shingles and pneumonia? They're only vaccines for the elderly. What are your thoughts on that?
Yeah, look, so we know that there's definitely there's two groups that are most at risk, right? We've seen from the previous criteria that we presented in the slides that definitely the elderly and definitely the younger are high risk. But the reality is that there are changes in risk even as we get older. So when you look at the studies that have been done in these vaccines, even after the age of 50, you can start to see increases in the risk, and the risk goes up as you get older. But that's compounded when you have other conditions, which is very common in our community. So diabetes and heart disease is so common, and those conditions themselves will automatically put you at high risk. So I wouldn't really look at shingles, pneumonia, and these type of things as just an elderly focused condition. And it has to be, within the context of what other things you have going on in your medical history. So what about another question, and maybe our final myth before we invite the rest of our audience in? Probably similar to what we've already discussed, but natural immunity is much better than vaccines, and some patients believe that it's better to do it themselves and better not to involve any other chemicals or any other products inside the body. How would we answer that?
Well, I mean, I don't disagree that natural immunity is good, and often healthy living supports that immunity. It's great to have lots of vitamin D, lots of vitamin C. There's plenty of good practices. Yoga is fantastic for your general health, but for example, vitamin D or X-rays can't create anti-influenza antibodies. It just can't. Only the flu jab can. But combining these sort of good health practices with vaccination offers this hybrid or synergistic protection. So it's important if we achieve this herd immunity by bringing lots of people together that are all vaccinated together. As a group, we can do our bit to prevent sort of millions of hospitalizations and deaths worldwide without creating collateral damage. So I think that's really, really important.
Yeah, and the vaccine, I mean, the viruses can't survive if you have a community of vaccinated people. That's the bottom line here, right? So if the majority of the population is vaccinated, the virus does not know or cannot infect and does not know where to go, and it cannot survive. So essentially, we can kill it off if we kind of use this thinking of joint up kind of herd immunity.
Absolutely. So should we hand over to Rakesh Bhai for some questions?
Yeah, that's fantastic. Thank you very much for Pujan Bhai and Nirav Bhai. That's been really informative. I think one thing in particular for me is that there's so many myths and so many things that you hear on social media from friends and family in relation to vaccines. We have two experts here, both doctors, and know the evidence. So essentially, the vaccines are safe to use and prevent illnesses, which sometimes we do not, we underestimate the impact they can have. So we heard about how flu and RSV can actually be fatal. So it's really important to make sure you're safe coming into this winter season. So just in relation to times, I know we're a little bit tight. We've had lots and lots of questions. So thank you very much for everyone answering those questions. I'm going to fire some questions at you guys. If we can have some sort of quick fire round answers. So the first question's to Pujan Bhai. It's a question from the chat. I know people have had heart attacks or blood clots after the COVID vaccine. Are these vaccines safe?
So the one thing you'll see from what we now do is nobody outside of the age of 75, and unless they're in a nursing home or if they have other comorbidities, is going to be getting any more COVID vaccines. The other thing to remember is the highest links to all these complications came from one of the AstraZeneca vaccines, and that is it's not even in the offering. So that's not being offered to people. That's not even being supplied within the UK supply chain. And there's a lot of use of the Pfizer vaccine. And so I think the chances of that really occurring are extremely low. And the other thing to remember is the cases that we heard about were within millions. So there was tens of millions of people getting a vaccine, and there were about 5, 6, 7 cases. So the thing to remember is that it's in the context of the broader population, but to reassure everyone, there's no use of the AstraZeneca vaccine in the UK, and that still means that those people that meet the criteria should absolutely go for the vaccination to preserve their future health.
Thank you, Pujan Bhai. Next question's to Dr. Nirav Bhai. In relation to side effects of vaccines, what should people expect?
So, great question. Sore arm hurts, needle in your arm, so that's bound to happen. A bit of a muscle ache. Occasionally, low-grade temperatures are very possible, especially for a few days afterwards. That doesn't mean if you don't get a fever, it isn't working. But remember, the vaccine is introducing an element of the virus or the bacteria that you're trying to have a prevention of. That means that your immune system is going to detect that abnormality in your arm. And from that, it's going to then start to create a response. And that's the immune response you're feeling, the fever, the lethargy, the arm ache, all of those symptoms that you can get are your immune system fighting and creating an army, a reservoir of soldiers to fight that virus off if and when it comes.
So it's always a balance between risk versus benefits, isn't it? So you're always going to have some side effects, but the benefits certainly outweigh those side effects and the risks associated. So a really good question in the chat is, if I'm not feeling well, can I still take the flu vaccine? And I guess that kind of corresponds to other vaccines as well. Dr. Pujan Bhai?
Yeah, I mean, look, the reality is when you look at the guidance, a lot of the times people say if you've got a mild sniffle, you should still go ahead and get the vaccine. But if you're feverish, you've got a bit more of something severe, then let that subside. My personal view, again, this is not supported by any strong amounts of evidence, is it's probably best to take it when you're feeling well. And primarily the reason I say that is because I don't want it to be kind of confounded by your current illness and then you developing this belief that the vaccine is causing you the sickness, or the vaccine is making you poorly. So I often would suggest to people that it'd be better to take it in good health. But we have to be mindful that the flu season is now and it's starting. So we can't just keep kicking the can down the road and say, okay, I'll wait another few weeks and I'll wait another few weeks. Timing is very important because in order to build up immunity, it does take a few weeks. And you need to maintain that peak immunity throughout up until March, April period. And so if you get it in now, this is when you can start developing that immune protection and antibody protection.
Thank you. So I've got a really good question in the chat here. So I had the flu vaccine last year, but I still got the flu. And that's something that we hear about with the COVID vaccine as well, that they've had the jab, but they still contract the illness. Dr. Nirav, do you want to sort of respond to that?
It's a great question. So if you look currently at the data that's coming out of Australia, which is the other side of the world, their winter was a few months ago. We're about to start ours, and that's modeled, that modeling based on what viruses, what influenza viruses were coming out of there, is based on what the vaccine is this year in what we give to our patients now. So there's going to be an element of grey there. There's going to be an element of potential. The virus still may mutate from where it was over the last 6 months in Australia to where it is over the next 6 months here. And it's possible to still catch a different variant. But by and large, the data has shown over years and years, over decades, that the flu vaccine saves lives because we get this right the majority of the time. And the viruses that we tend to get coming across from Australia are the ones that we tend to see large peaks of now. Unfortunately, what we've also seen this year particularly is a real resurgence of a bad type of flu in Australia. So it's been quite a deadly year for them this season. So it's worth us really protecting ourselves, knowing that that's the sort of resurgence that they're getting over there, that we should really protect ourselves early this year.
Fantastic, thank you. Another great question is about eligibility. So if you're not eligible for the flu vaccine on the NHS, what can you do?
I can tell that one. You can buy it, but you can buy it. So you can go to a pharmacy and ask for a private flu jab. Private COVID jabs are also available, should you wish to. I think usually it's about £10 or £15 for a flu vaccine and about £100 for a COVID vaccine. But again, there are reasons why immunity may not be required for non-eligible patients. But you can talk to the pharmacist about whether you should or shouldn't have it. Generally, if you are living in one of those at-risk scenarios and you are a carer for your elderly parents or you have vulnerable people in your home, then you might already be eligible. You just don't know it. And you might want to ask the pharmacist if you do qualify based on your particular circumstance.
Perfect. And then a part of that same question was, and I'll address this to Dr. Pujan Bey, is when should I start worrying about a cough?
Yeah, no. Look, so the trouble is probably a bit broad in the sense that it's a timeline-based probably response that I would say. So when we define what a chronic cough is, which is a long-standing cough is a cough that's been going on for more than 2 to 3 months. So in the earlier stage, so earlier than 2 months, if you've been coughing, a lot of the time it's probably going to be something that's related to maybe a post-viral stage. So if you've caught a cold or a virus, you can have a cough for a good number of months that can linger, unfortunately. The other trouble is that coughs come from lots of other things. So the medicines you could be taking could be causing you to cough. Your stomach. So sometimes when people have a lot of heartburn or indigestion, that can also be driving a cough. You can get a cough because you've got too many secretions or too much dripping from your nose going down the back of your throat. So there's a lot of reasons why people can develop coughs, and I haven't even talked about lung problems that can cause cough. So the reality is that when it comes to cough, I would absolutely say that if you've had a cough and it's been longer than 2 months, that absolutely needs to be escalated. If you're coughing up any blood, that's plenty. That's enough excuse to go straight to your GP. And I think those are really the most alarming features. Anything like a new cough and unexplained weight loss, that all those features are kind of combined with the cough as opposed to just cough alone. So cough alone is not enough to really drive anything, and it does need to be thought of and looked at from 5 or 6, 7, 10 different angles to really get to the heart of what this cough is and why you have the cough.
Yeah, and just
Fantastic.
to add to that, often in general practice, we'll see patients a lot before that 2 months is up, and we may see them at around 4 weeks, so 1 month in, where we start to investigate some of these things. So if you're starting to see coughs lingering past 4 weeks, then definitely go and see your GP so they can start working you up in what Pujan said. Start looking at chest X-ray, start checking out for acid, checking your medications, and trying to rule out what other things could be going on before the 2 months mark is up.
Thank you very much. I think it's vital that if you have symptoms and you're worried, then go speak to a health professional. And I think your GP is a really good first port of call. We've had a few questions in relation to children and childhood vaccines. And I would signpost people that we're going to be having a webinar in December on children's health, and we will be talking about vaccines with our specialist panel there. But there's one which I would like to ask you, Nirav Bey, and it's in relation to vaccines and autism. And I suspect that's more commonly related to MMR. Do you want to just give a comment on that?
Yeah, sure. So this is not one that I'm shy about, because I think it's really important to hit this head on. The MMR vaccine does not cause autism, and I can say that with the biggest full stop that I can. There is no link between MMR and autism, no matter what the Daily Mail says or online says. Unfortunately, there was a doctor many years ago now who falsified some data and then published his results in a big journal. That then was discovered. He then subsequently lost his license, and the trial has been repeated many times all over the world, and it's never shown that MMR causes autism. So with the biggest "it doesn't cause autism" flag, I can guarantee that. However, I know that the myth still persists, and I know that lots of people come in worried about it. But please don't always read and believe what you see online. Speak to a healthcare professional. Ask them genuinely what they do, and you know, one of the biggest questions that you can ask them is, did you give it to your own kids? And I will say yes, you know, we will, because we don't believe these myths, and actually, if we're willing to give it to our own children, I think that's sometimes the biggest message that we can share.
Yeah, in relation to that, again, I'm sure both of you have had your flu vaccine this season as well. So I just want to ask one final question to both of you, and it kind of encompasses what we're doing with our wellness program, which is a holistic approach to health. In terms of having the vaccine, we've discussed how vitally important that is across flu, COVID, RSV, etc. Are there any other things that we could be doing to keep ourselves healthy during this winter? If I could just get you both in on that. If we start with Pujan Bey.
Yeah, look, winter time is actually high risk for a number of reasons, and we've all already started to notice it's getting darker sooner. The impact on your mood and your mental well-being is quite significant, and you'll notice as the months go by. So the energy levels, the interest in doing things such as exercise, the interest in doing things that actually get you out of the home, you know, small things, going out for a quick walk after a meal, after you all those things you'll be less likely to do. But in fact, you're probably going to do yourself more harm than good, because the more we stay indoors, cooped up around each other, you're probably going to get even worse. And so I think it's just to encourage you to kind of focus on those things that you can control. And that would probably be one thing that we see a lot of, and it's natural. It happens to all of us. You can see the moods change. You're on the tubes, and you can see the environment of everyone's faces looking more miserable. But that's just part and parcel of being here. So that's probably one thing I would add to the wellness component. I'm sure you have some thoughts, Nirav.
Yeah, I mean, as it gets colder and darker, our vitamin D levels are going to start dropping. No harm in taking your daily 1,000 units over the winter periods. Definitely, you can buy that very, very cheaply in pharmacies and supermarkets these days. Vitamin C is really important, but remember the basics: stay well, stay hydrated, keep doing your exercise, keep going for your walks, even if they're not high intensity, vigorous exercise, and don't just carb out and sit on the sofa and watch TV, because you're going to get yourself more and more unfit. So if you do come across a virus, you're already your pre-illness state, your pre-illness morbidity is going to be worse off. So try and keep as well as you can, so that any winter bugs don't have a chance against you.
Yeah, I think it's a great opportunity too as we move into the winter to pick up some good habits, and that might be in relation to your nutrition, it might be in relation to your exercise, your activity, but also sleep and stress management as well. And please do, for everyone on this call today, look at our YouTube link where there's plenty of other videos talking about those topics I've just mentioned. So, as we come to the conclusion of this evening's webinar, I want to say thank you to Dr. Pujan and Dr. Nirav for sharing their expertise. I guess for me, the take-home point is as we move into this winter, it is imperative we all take action now and ensure we are vaccinated and protected against these illnesses. Both flu and COVID vaccines are available from pharmacies, but it's also vital that your GPs may be contacting you if you're eligible, and important to get these jabs into your arms as soon as possible. The QR code on the screen shows eligibility criteria. So if you're unsure if you're eligible, please do scan the code and that will post you to the NHS website with all the criteria there. But if you're unsure, ask your GP, ask your pharmacy. Finally, we are really grateful for your time this evening and supporting our wellness series, and would like to remind everyone that all of our episodes are available to watch on YouTube. To ensure we continue to host webinars which are useful to you, I would ask if you could just take 1 to 2 minutes to fill in the feedback form so we can tailor these sessions to what you need. And the QR code's on the screen now, as well as a link in the chat. Thank you again, and we look forward to seeing you all in November for our next webinar on men's health. Jai Swaminarayan.